Thank you, Minister. And can I just echo some of the Minister's comments? We have seen a rapid uptick in cases, and what we believe is that Omicron is driving that uptick. A little bit of it's driven by Delta as we get in out and about and we socialise. We were seeing that uptick in cases, but primarily we believe that Omicron is certainly driving the uptick in cases, particularly in Newcastle area. We've had a number of super spreading events, and what it's highlighted is what we know internationally about Omicron is its increased transmissibility. What we don't know yet is clinical severity. Everyone is working together to get the best information we've got across the world to understand the clinical severity. And that's going to be a key component. But we do know that boosters are critical in getting that immune response, because the current virus does seem to evade your immune system, both when you've had previous strains of the virus and also vaccination. So it does escape the immune system, and that is why we are seeing that is contributing to Omicron's growth and the R effective being so high with Omicron. I think the Minister's given such wise advice, and all I can do is echo it. I would urge everyone to continue to wear masks in indoor environments. It's a small price to pay. I know that it can fog up glasses, and I can know, it can be annoying, but it's a very tiny act, and you're actually protecting yourself, but more importantly, you're protecting others. Just remind you that you often don't know you've got COVID and you're infectious. Remember, you're infectious before you even get symptoms. Sometimes people can have such mild symptoms. So that simple action is really very much a community-minded action, and I would urge us to continue to wear those masks in indoor settings. Secondly, just at this time, think about the sort of nature of settings you choose for your functions. Picnics, outdoor cafes. We've got a beautiful environment now that it's stopped raining. So use those settings. They're much lower risk. Also, we do want to preserve Christmas. I know many people have had their Christmas plans interrupted, and this might be the first time that people are able to reunite across state borders or boundaries. So please, just limit your activities and your social networks and your interactions. Be safe in that time so we can keep those special occasions not impacted by COVID. I would also like to acknowledge the community's response to testing. And thank you very much. Continue to come out for testing. It is important, though, that you do follow the public health advice. We are now moving to very light touch contact tracing with the case numbers we've got and the case numbers we expect. We know the greatest risk that people will have will be household contacts. The other group that we'll focus on is what we call in health household-like contacts. And they're, for instance, partners or boyfriends that sleep over, or boyfriends, girlfriends, people that sleep over, or people that you've spent, several hours at a nightclub vigorously dancing with. There'll be a few people that we, in addition to those household contacts, identify as very high risk of transmission. And then there'll be times where we have, for instance, like the nightclub in Newcastle, where it's pretty evident pretty quickly that that was a super spreader event. So we immediately alerted people to make sure that everyone was aware of that risk. One of the things that we're trying to stop is people going into aged care settings and vulnerable settings, like disability homes, our healthcare facilities. And so we will be really continuing to have mask wearing in those high-risk settings and ask people to be very cautious about those settings. And as I said, if you can do your visits outdoors, that's always the safest place. So just wanted to acknowledge that we are in a time where we're expecting to see escalating case numbers increase. We still don't have enough information to inform our assessment about the severity profile, but we believe that that information will be emerging over the next 2 weeks, particularly from the UK, our own experience, and also from countries like Denmark, and clearly we're also monitoring the situation in South Africa. But what the steps you can fundamentally take is keep yourself safe, get tested if you've got any symptoms, realise that your risk of coming across Omicron is going to be very high and increasing, so make those decisions for yourself. Get a booster. I can't stress that. Please get a booster. We know that third dose will really elevate your immune protection, and you need that with Omicron. and otherwise just make those personal decisions and take those personal decisions wisely. Thank you.